Across the globe, no condition claims more lives than cardiovascular disease. It is the leading cause of mortality, responsible for millions of fatalities each year as vital blood vessels narrow and ultimately fail. This burden is particularly heavy in underrepresented rural communities across the United States. In these areas, isolated healthcare deserts, patients face high rates of obesity and physical inactivity, often with no local access to basic preventative care or health education. The geography of this disease is rapidly expanding. In modernizing nations like India, cardiovascular disease is striking South Asian populations 5 to 10 years earlier than the global average, targeting individuals during their most productive years. This global spike is driven by the transition to a modern lifestyle. We have adopted daily habits, highly processed diets, sedentary work, and late-night screen use that actively work against our basic biology. Addressing a crisis of this scale involves looking past the walls of the clinic. We have to address the behavioral mechanics driving it: how we eat, how we handle stress, and how we sleep. For decades, modern medicine has relied on a reactive approach. We wait for a catastrophic cardiovascular event to occur, a heart attack or a stroke, and then intervene with complex surgeries or aggressive pharmaceuticals. The failure point in this model is that treating the aftermath is rarely a sustainable cure. Clinical studies show that patient adherence to long-term blood pressure and heart medications is notoriously low. Relying entirely on a pharmacy falls short, because a daily pill cannot undo an environment and a routine that continuously strain the cardiovascular system. Survival is no longer the benchmark for health. True cardiovascular vitality depends on an immediate move toward proactive, holistic prevention. The medical establishment is acknowledging this reality. The American Heart Association recently updated its clinical framework to Life's Essential 8, marking an official transition from merely treating disease to actively promoting health across a lifespan. This diagram illustrates the mechanics of chrononutrition. New evidence shows that when we eat is just as critical to our heart as what we eat, connecting meal timing directly to our immune system and fat metabolism. Eating late into the night forces the digestive system to work when it should be resting. This directly disrupts the body's internal circadian clock, sabotaging the overnight repair processes that keep blood vessels flexible and clear. Looking at this flowchart, we trace the chain reaction. A disturbed internal clock triggers physiological disturbances and oxidative stress, leading directly to inflammation and arterial stiffness. This accelerates cardiovascular risk, leading to hypertension, stroke, and myocardial infarction. Prolonged overnight fasting reduces these risks. By aligning our mealtimes with our natural biological rhythms, we transform our daily diet into a form of preventative medicine. While diet is crucial, chronic psychological stress acts as its own physical toxin. It triggers a constant release of cortisol and adrenaline, hormones that increase heart rate, spike blood pressure, and inflame the lining of our blood vessels. This chart illustrates clinical trials at Kent State University that tested a counter-strategy. They found that mindfulness-based stress reduction resulted in significant decreases in blood pressure, matching the effectiveness of strict diet and exercise changes. Researchers describe this practice as fitness for the attention muscle. By utilizing structured body awareness, gentle yoga, and meditation, patients actively retrain their brain's stress response to protect their physical heart. This interconnected approach is why the American Heart Association recently added a specific 8th pillar to their health framework: sleep. At the molecular level, circadian rhythms are governed by clock genes. When we are deprived of quality sleep, we disrupt those molecular oscillations, disabling the heart's ability to clear plaque and repair cellular damage. Stress reduction and proper sleep are active biological requirements for cardiovascular survival. Modern science has confirmed a hard biological reality. To reverse the compounding damage of the modern world, we must consciously align our daily lifestyles with our natural biology. Combining modern nutritional timing with the holistic traditions of Ayurveda and daily mindfulness creates a comprehensive shield against these lifestyle disorders. This level of health transformation begins with the community. It starts with neighborhood access to fresh food and localized education that brings these scientific insights to the individual. This is the foundation of the 369 Samruddhi mission. By teaching small, sustainable habit changes at the community level, we create a ripple effect of health, personal wealth, and lifelong happiness. The science is clear, and the tools are within reach. Join the movement for a healthier heart at 369samruddhi.success.com.